Learning the rules. Glove rules. How, when, and why we use gloves. A presentation brought to you by 4YourCNA.com. In this lesson, we will talk about glove use. Gloves are commonly worn in medical settings, such as hospitals, assisted living facilities, nursing homes, home care, and hospice. But have you ever thought about who those gloves are there to protect? Are the gloves there to protect you or the patient? Actually, they are there to protect both. But they will only be effective if used properly. Gloves are worn to protect healthcare workers from exposure to the pathogens that made your patient sick. When a patient has an infection, their body has been invaded by pathogens like viruses, bacteria, or other microorganisms that cause disease. This patient is now a host. Pathogens use host cells to multiply. They rely on the host to live. These sick patients, or hosts, bring their pathogens with them to healthcare facilities. But you can't tell what pathogens a patient has by looking at them. Some patients can look completely healthy, but have a very serious pathogen hiding inside. So for that reason, we use standard precautions with all patients. Standard precautions, or universal precautions, means that we treat everyone as if they have a pathogen hiding inside of them. As long as the pathogen stays inside the host, they are only a danger to that person. Pathogens in a host are trapped inside by the patient's skin. Pathogens need a way out of the host. Pathogens can get out of the host through any of their holes, such as eyes, nose, mouth, genitals, anal area, incisions, wounds, or rashes. Pathogens have no legs. They can't travel on their own. They need a vehicle to get around. They travel in blood, body fluids, and rarely on air currents. But most pathogens can't survive very long out in the open. They need a nice, warm, new host to live in. Pathogens can't get past your skin. They have to find a doorway in. Pathogens have to enter a new host through one of their holes, such as the eyes, nose, mouth, genitals, anus, incisions, wounds, or rashes. Pathogens usually don't have to wait around long. Most people touch their face several times every hour, and your face has lots of holes for pathogens to enter. If a pathogen is able to find a way inside, that person must be susceptible to infection. Lots of things can affect whether a person becomes infected, including the effectiveness of their immune system, their vaccinations, rest, nutrition, and current health status. If the patient is susceptible, now they have become a host to the pathogen. But the pathogen is stuck inside unless they can find a doorway out. Caregivers are often in contact with body fluids, which may be carrying a pathogen. Sick patients often need help with toileting, grooming, bathing, etc., which puts us in contact with patients' body fluids. We have no way of knowing which of those body fluids will carry a pathogen. So, to be on the safe side, we treat all body fluids as if they have pathogens. So, by being aware of the chain of infection, we can use 3 simple rules to know when to wear gloves. You should wear gloves if any of the following apply. If you might touch something wet and sticky that came out of someone else, you need gloves. If you are going to be touching personal skin, such as the breasts or genitals, you need gloves. If you are going to be touching non-intact skin, such as wounds, rashes, or incisions, you need gloves. Basically, you don't want to touch anything that comes out of another person's body with bare hands. So now you know why you need to wear gloves and when you should wear gloves. But the most important thing is learning how to use gloves properly. A common question caregivers have is,
can't I just wear gloves for everything?
And while yes, you can certainly make that decision when at work, it's not a wise one. Why? There are 3 reasons: economic, environmental, and behavioral. The first is easy. Gloves cost money. A facility bills patients and insurance for services. It then receives money for providing those services. That money pays for operating costs for the facility and employees. But that money also has to pay for patient care supplies. And yes, even gloves. Using unnecessary supplies reduces the amount of money available for wages. Want to know where your raise went? Well, supplies are expensive. The second reason is environmental. Medical gloves come in two basic varieties, latex and nitrile. Gloves are disposable. They are never reused or recycled. This means that all gloves will end up in a landfill somewhere. Latex gloves take a long time to biodegrade, which means our landfills are filling up with tons and tons of gloves. But even worse, nitrile gloves never biodegrade, which means they are on this planet forever. With the amount of gloves used in medicine every day, it's easy to see that this could soon turn into a serious problem. The third reason is behavioral, and this is the most important reason why you shouldn't wear gloves all the time routinely. When caregivers wear gloves all the time, they stop paying attention to what they touch with those gloves. Caregivers touch a lot of things in a clinical setting. Some of those things are clean, and some are dirty. And this is where the problem is. If you have dirty gloves on and you are touching clean areas, you are contaminating those surfaces. When you are wearing soiled gloves, you must take special care not to touch clean surfaces. But there's a much bigger problem with gloves that put your patient at risk. Remember these guys? These sick patients brought all of their pathogens to the facility with them. That means that almost every patient in every room will have some sort of scary pathogen, all under one roof. Now, these patients don't go room to room visiting each other in most cases, but we do. So caregivers pick up pathogens from one room and take them to another room on their skin, hair, clothing, shoes, stethoscopes, pens, etc. Healthcare-acquired infections, or HAIs, are a real problem in healthcare. A 2014 report states that the CDC estimates that on any given day, about 1 in 25 patients in an inpatient setting has at least one healthcare-associated infection. That means that we gave them an infection that they didn't come in with. As caregivers, it is our job to keep our patients safe. Remember that our patient is sick. They are sick enough to be here rather than home. This means that their immune system is working on another problem, trying to get the patient well again. So they will have a harder time overcoming any pathogens that we expose them to, because their immune system is otherwise occupied. It's our job to make sure that the patient doesn't get exposed to other pathogens while receiving care. So let's say that you need to brush this patient's teeth. You know you have to wear gloves because you will be exposed to body fluids. But knowing when to put the gloves on is important. Those gloves are going to go into the patient's mouth. If someone were brushing your teeth, would you want clean gloves or ones that had touched lots of surfaces first? We know we have to do the opening and put the head of the bed up before washing our hands. And then after washing our hands, we will gather our supplies. No gloves yet. Everything your gloves touch will contaminate them before they go into the patient's mouth. So prepare all of your supplies first. No gloves yet. Now that you are completely prepared and ready to begin brushing, you should put on your gloves. Keep your gloves clean for your patient. The first thing your gloves should touch is the patient. So to recap, gloves are there to protect both the CNA and the patient. If you are going to touch anything ooey-gooey, personal skin, or non-intact skin, you must wear gloves. And finally, keep your gloves clean for the patient. Contaminated gloves can cause healthcare-associated infections. You must consider the glove rules for every skill. If any of the reasons apply, you must wear gloves. For the exam, gloves will only be required for mouth care, denture care, peri-care, catheter care, partial bed bath, bedpan, and emptying a urinary drainage bag. They can be worn for other skills, but are not required for any other skill during the exam. Even though gloves are not required for a specific skill during the test, you may need to use gloves in a clinical setting for those skills, based on the situation. If you are doing range of motion and the arm you are working on has a rash, you need gloves. If you are changing an occupied bed and the patient is incontinent, you need gloves. If you are transferring from a bed to a wheelchair and the patient has a catheter bag that you will be moving, you need gloves. Always refer to the 3 glove rules to determine if gloves need to be worn. So you should now have an understanding of why, when, and how to use gloves. Use them properly to keep both you and your patient safe.